If your doctor has ordered a medical imaging exam for you, such as a computed tomography exam or a magnetic resonance imaging, or commonly known as a CT scan or an MRI, we understand that it can be intimidating. But medical imaging exams are an essential step when diagnosing and treating diseases. What happens is they capture images of parts of your body that will allow your doctor to properly diagnose a medical condition that they suspect. But there are many different kinds of medical imaging exams, and knowing what they're for and the benefits as well as the risks can help better prepare you for the procedure. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. There are a number of medical imaging exams used to diagnose different medical conditions. Here on MedTalk Health Talk, we'll discuss the different kinds and why your doctor might recommend one over the other. Let's welcome our guest for today. With us is Dr. Tamara Razon Cuenza. She's a radiologist at the Medical Center Manila and the Medical City at Clark, Pampanga. Also with us is Dr. Dave Gamboa. He's an emergency medicine specialist and vice chairman of emergency medical services at the Philippine General Hospital and board director at the Philippine College of Emergency Medicine. Now, CT and MRI scans are among some of the most common medical imaging exams available today, and many often confuse the two. They have a number of similarities. For one, they both capture images within your body. But for the most part, when someone asks to get a CT scan or an MRI, they don't see any distinction between the two. First, I'll ask this to Doc Tammy. Could you tell us some of the similarities between the two first?
Both a CT scan and an MRI, we consider them cross-sectional imaging. And when we say cross-sectional imaging, the way I like to explain it is it's as if there's a loaf of bread and you need to slice it into pieces, into different slices to be able to see the inside of the loaf of bread. And it's sort of like a similar thing with the human body. With the CT scan and the MRI, you sort of use slices of the body to be able to see the inside and analyze it. So that's the similarity. They're both cross-sectional imaging. They both can help in diagnosing certain pathologies.
CT scans and MRIs help detect potential life-threatening conditions like bone injuries, tumors, aneurysms, and even cysts. Now that we've heard the similarities, it's worth knowing both scans have very distinct differences. Doc Tammy, what are the main differences now between a CT scan and an MRI?
A CT scan uses X-rays, so it uses radiation, and just like an X-ray, it uses sort of like the density of structures so that you can tell the difference between these structures to be able to come up with your anatomy and pathology that you see on the CT scan. And so that's radiation based. And it actually is a very fast study. It's quite quick. Whereas an MRI, it does not use radiation. It's based on a superconducting magnet. That huge machine that you see is a superconducting magnet, and radio frequency as well. So it uses radio frequency and magnetism to sort of come up with these images, whereas CT relies on the density of the different body parts.
Doc Dave, when will a doctor most likely recommend to use a CT scan?
When do you use CT scan? I would use a CT scan if I would like to see something that cannot be seen beyond an X-ray. Mm-hmm. And the chances are I would request maybe for a chest CT or an abdominal CT scan, or more likely for patients with stroke, it's almost a standard treatment for a CT scan. So something that you would like to see inside of a person's body or a person's organ.
Doc Tammy, could you walk us through how a CT scan is vital in diagnosing malignant or cancerous tumors?
Both CT and MRI can diagnose cancers, but a CT, the way that a CT would work is, especially when it comes to tumors, you would sort of you would have the patient come in. We would make sure that they have a creatinine result because we would be giving CT contrast. We'll be placing a line so that we can give the patient the contrast. If we just do a non-contrast CT scan, it would take less than a minute. But if you have all these contrast phases, especially in terms of tumors, you need all of the contrast phases to assess the tumor, it would take a little bit longer, so about maybe up to 5 to 10 minutes.
Now, Doc Dave, we're talking about CT scans, how important that is. Let's talk about MRIs. When would a doctor request an MRI? What would be the advantages of this?
We would request for an MRI if we want to define certain organs in the body that cannot be enhanced by the CT scan. As what Dr. Tamara just said a while ago, that the use of MRI has more enhancement versus a CT scan. Though it is faster, MRI can actually identify even thin sheets of parts of the body.
Doc Tammy, years ago, during its early infancy of these machines, one of the problems that a lot of patients would complain about was it was very claustrophobic. They had a lot of anxiety, a lot of fears. Is that the case now with CT scans and MRI machines?
So with CT scans, it's very unusual for the patients to feel claustrophobic because it's quite open. I sort of compare it to the difference between, let's say, a CT scan would be like a donut. It would just be short, whereas an MRI really would be more like a tunnel. So I think the MRI, of course, would have a lot more problems when it comes to patients, if patients who are claustrophobic. However, you are right, technology has evolved a bit, and now we have machines with larger bores.
Is there some pain? Is there some discomfort whenever having any of these exams?
You know, these patients come in and you have to understand also that they are very anxious. First,
Right.
they're being, this procedure is being requested. It's a source of anxiety in itself because they're worried about their condition. And then here you are, having to make them go through this procedure. But what we do is we try to help them to relax. We try to explain the procedure properly. I always tell my patients who have CT and MRI, just relax, just breathe, just continue to don't think about it so much. Those are the things that usually help them go through it.
Dr. Dave, I'd like to ask for our viewers who are wondering what type of thought process goes through the mind of a doctor before they request an exam such as an MRI. Do you take anything into account beforehand, before requesting these exams?
We walk through the patient with these things, and we discuss the disease process and the impact of the disease if we are not able to find out what's going on inside. If I wanted to see something inside that I cannot see physically, then I will tell the patients or the relatives that it is something of a must, and tell them the gravity or weigh the consequences of not finding out or finding it out.
Getting an MRI or a CT scan are both low risk, but there are safety comparisons worth knowing. We'll discuss this after a short break. Keep it here on MedTalk Health Talk, your partner in healthcare. This is CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where your healthcare comes first. So just a review on MRIs, usually recommended if a more detailed image of your soft tissue, your ligaments, or some of your organs are needed. And some of these cases include herniated discs, maybe torn ligaments, or some type of soft tissue issue. But if a CT scan is recommended, usually these are really best if you have injuries that involve your bones or fractures such as head trauma. Now, one safety issue of a CT scan worth knowing is the exposure of ionizing radiation, and this can slightly increase your risk of cancer. Dr. Tammy, can you tell us more about this? First, let's explain the risk level of these machines, especially that of the CT scan where it has radiation. Is cancer a risk in this case?
The thing is, nowadays with our current technology, our newer machines, the radiation doses have gotten very, very low, and the risk has gotten very low as well. And like we always say in radiology, we always try to keep the radiation dose as low as reasonably achievable. And nowadays, it's very highly possible to get that dose to an amount that's pretty much negligible. unless you've had multiple repeated exposures, which most patients don't really have.
Doc Dave, is this something to be worried about? A person being allergic to any of the contrast media that is being used? If so, what type of preparation is usually done to prevent this or to mitigate this?
Any procedure, most especially this one, that has certain impact or certain exposure, would normally entail also risk. And part of the risk is are allergies. And since most especially if you will be using contrast medications or contrast intravenous medication, patients are really at a high risk of developing diseases. These are part of the screenings. There are certain questionnaires that we do ask patients if they have been allergic to some sort of contrast, some sort of medication, before we subject this patient into these procedures.
Talking about MRIs, trying to alleviate the fears of a lot of people. Since MRIs use a powerful magnet, a lot of people may be asking what will happen if I have some metal on my body at the time of the exam. Dr. Tammy, let's talk about that. What about having metal implants in the bodies, metal plates to treat a previous fracture, other pieces of metal or implants on the body? How safe is it to undergo an MRI exam?
It used to be that if you have metals in your body, you can't have an MRI. But now this is not really true. Now, if, let's say, the metal implants are fixed, for example, in a bone, and you have a metallic plate affixed with screws, and it's been there for a very long time, that is not a movable metal, and you can actually have the MRI procedure. The only time probably we'll say that you can't have your MRI is if you have, let's say, bullet fragments that can easily move. So there's a big difference. One is MRI unsafe, and the other one is MRI compatible.
Now, aside from an MRI and a CT scan, there are other tests that can determine if you have a medical condition. We'll go through them after a short break. We want to be your partner for a lifetime of good health here on MedTalk Health Talk, so stay with us on CNN Philippines. Welcome back to MedTalk Health Talk. I'm Dr. Freddy Gomez. Medical imaging exams are vital in diagnosing and treating diseases. They capture images your doctor needs in order to determine what's wrong. And while the CT scan and an MRI are two of the most thorough exams, there are other tests used for different circumstances. Now, all throughout the program, we've purposely alleviated that of X-rays, but an X-ray, I'm sure most of you have already experienced getting an X-ray, and it's been around for over 100 years, but it's still one of the most used imaging studies by doctors today. Dr. Dave, could you tell us more about X-rays? They've been around for so long. How crucial or how useful still are X-rays with clinicians?
I think it is because of our exposure. Of our exposure on learning to see X-rays. As a basic tool for all medical students, they will see X-rays. Even in our med school books, you will see X-ray films. And being at that, because you're so exposed to it, and that's the first thing you want to see after you go. After you are into the clinics and as a med student. And once you go into training, X-ray should be part of your tool as a resident.
Doc Tammy, is it usually the case that the more expensive the exam, the better?
Not at all. Really, an exam should be tailored to the clinical question. So, and to the indication. If a patient has a certain pathology, that's what you tailor your exam to. Sometimes the exam is simple and cheap, and sometimes you need something a lot more expensive. So, for example, an X-ray, it's ubiquitous, it's basic, but it's so essential. So if we have a patient who may have pneumonia, we are not going to jump into a CT scan. We're going to do a chest X-ray as a screening tool. So it's usually your first step. And it's very, very basic and very, very useful.
Right. Now, another non-invasive medical imaging exam includes ultrasounds. Ultrasounds work by using high-frequency sound waves to produce images within the body. Now, a sonogram consequently is the image produced during the exam. Dr. Tammy, could you please tell us and elaborate on how ultrasounds work or the ultrasound exam? How does this help the clinician get a better picture of the patient?
Well, in ultrasound, unlike a CT, it does not use radiation. Unlike an MRI, there's no magnetic field or radio frequency. Instead, it's quite simple. It's sound waves. That's why we call it ultrasound. So the ultrasound actually has a transmitter which emits sound waves, which bounce back off the organs of the body and have a receiver. And in a way, the way I like to explain it is that just like the radar of an airplane or the sonar of a submarine, that's exactly how an ultrasound works. It bounces back an image, and the reflection of the waves really depend on the body part. For example, we say something is echogenic if it reflects back as white, or something that is anechoic if it reflects back as black. So just a basic use of an ultrasound, for example, is to look for a gallstone. The gallbladder itself has fluid inside, and that is black. But then when there's a stone inside the black fluid, we see that as white. So it's very, very obvious on the ultrasound. And gallbladder is, for example, one of the best indications to use an ultrasound. It has its certain indications where it's very, very useful. Gallbladder is one, thyroid is another example, breast is another example, and that's where we usually apply. And of course, there's no radiation as well. So that makes it even more useful for these particular organs.
Okay. Now, Dr. Tammy, where do you see medical imaging 10, 15 years from now? Are we already at the pinnacle? Can it not get any better than we are now?
We're definitely far from the pinnacle. It can get so much better. For example, in my specialty, before we were able to image the brain on MRI very easily, the spine. But for example, now, years down the line in my own specialty, I'm actually able to image a beating heart on both MRI and CT. And I think before this was not even possible. So MRI and CT especially have a very long way to go still. The indications for these tests and the uses of these tests in clinical practice have only expanded more and more. And I think there's really there's a lot more to go because they're really based on technology.
Now, these medical imaging exams are considered safe. All those that we mentioned, both CT scans, MRIs, ultrasounds, and X-rays, in the long run, they offer very important information to properly diagnose conditions and care for your health. But of course, we want you to feel comfortable whenever you take these exams. So if you have any questions or concerns before taking an exam, don't be afraid to ask questions. With that, I'd like to thank radiologist Dr. Tamara Razon-Cuenza and emergency medicine specialist Dr. Dave Gamboa for being with us today. We hope our conversation was very helpful to you all. Choose well and choose to be healthy. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.